Hello everyone, my name is Gaida. This presentation was prepared as part of the HAP 823 course on causal analysis and comparative effectiveness taught by Dr. Farrokh Alemi at George Mason University Department of Health Administration and Policy. In my presentation, I'm going to cover question 5 under causal networks. This is the question I'm trying to solve. Using the data provided in Analytica software, construct a network model of COVID-19, influenza, and other upper respiratory infection symptoms. Create a node at the center with 3 levels. So first, we lasso regress the disease variable on all symptoms, age, and gender. This regression will identify variables in the Markov blanket of the disease. First, we're going to install the package in R. Then we're going to load it, we're going to read the data, and we're going to create the X and Y. The Y is going to be the disease, and the X is going to be all the variables except the disease. And then we're going to fit the model and plot it. And this, as you can see here, is the plot I got. Then we print the model fit values, and we find the coefficients. After that, we get the minimum lambda, and then we set the S to be 0.01, or we can do it by lambda.min. The results in the slide show lambda.min. Then we repeat the lasso for all the variables as response. You do not need to repeat all the steps, just the lasso or the coefficient parts. In front of you, you can see the parts that you are to repeat. The code, as you can see, you need to do the X and Y again, and then you need to fit the model and do the coefficients. You can see that the coefficient in the screenshot in front of you are for another variable, not the disease, and I use the S as 0.01. So you're going to do that for all the variables as response. After I got all the coefficients for all the variables as response, I put them all in a table in Excel. For all the variables, I use 0.01 instead of lambda.min. Before we get the data to Analytica software, we do need to do some changes to the data. First, we convert the columns from binary to yes or no. The 1 would be yes, the 0 would be no. And then we convert the gender column from 0 to female and from 1 to male. And then we convert the age variable to a categorical variable. The age was converted as follows: 0 to 17, and then 18 to 43, 44 to 64, 65 to 75, 75 to 105. And you can do this either in Excel or in R. Now we go to Analytica software. Using Analytica software, we draw an arrow from the disease variable to symptoms that were statistically significant in the lasso regression. Symptoms, by definition, occur after the disease, and demographic variables occur prior to the disease. In my results, I focused on coefficients of 0.15 and more, so the coefficients less than 0.15 were ignored. And then we draw an arrow from demographic variables to the disease, if the demographic variable was a significant predictor in the lasso regression. And then we use each symptom that is statistically significant in the first step as a response variable for a new lasso regression. The independent variables in these regressions are the disease variable, other symptoms, and gender. And we draw an arrow from the variables that are statistically significant to the symptoms used as response variable, and we repeat for other symptoms as response variable. Then we enable Analytica software to learn the parameters of the model and report the results. This is the result after I compiled the network. I made sure to include only the variables that were connected to the disease variable from the regression results, and I also made sure that there are no cycles. For example, I had an arrow from chills to headache and another arrow from headache to chills, so I decided to keep the arrow from headache to chills based on the biggest or the bigger coefficients. And as you can see, there are errors coming from, for example, running nose to cough, or from cough to fever. Those were when we turned those symptoms into response variables. Thank you so much for watching. I hope this was helpful.